Hello, I'm Dr. Leslie Ellis, and this brief presentation is about the strong link between suicide and nightmares. And because the link is so robust, and because there is very little in place to do something about this, the research and the information put together really constitutes a very strong call to action. So this is just a brief summary of what a couple of research studies have shown that have really looked at the whole picture and are very current. And there are numerous studies over the last decade that back this up, but I just wanted to summarize the research with a couple of really important studies. This information on this slide is based on a recent article in Current Opinion in Psychology that looks at the role that nightmares play in suicide. And this and many other articles conclude that the link between nightmares and increased suicide risk and increased suicide attempts and increased suicide deaths is robust. Although specifically how this happens, how nightmares are implicated in suicide, is really not been made clear. Poor sleep quality also increases suicide risk, but nightmares remain a factor even when sleep deprivation is controlled for. Similarly, nightmares have been shown to be associated with suicidal behaviors independent of several psychiatric risk factors for suicide, such as depression, anxiety, and PTSD. So there's something in the nightmares themselves that makes them particularly predictive of suicide. The researchers concluded basically that nightmares are an independent risk factor for suicide, and the more frequent the nightmares, the greater the risk. And this is a new finding because it used to be considered that nightmare distress was the more important variable and that frequency wasn't as important. But more current research shows that really it's the frequency that might indicate the greater risk, although both of them really should be considered. So I just pulled some statistics out of one very alarming study that was done in 2007 as an example of some of the many different studies that have looked at the link between suicide and nightmares. And in this study of 165 patients that were admitted following a suicide attempt, 2/3 experienced nightmares and a third had reported severe nightmares. And so nightmares had the strongest association with suicidality in this suicide assessment scale that they were using. And the researchers concluded that nightmares predict suicide attempts and suicide deaths. In fact, this is the alarming statistic I wanted to point out, that the study found that those with nightmares were 4 times more likely to both attempt suicide and repeat a suicide attempt. And this was after controlling for depression, anxiety, PTSD, and substance misuse. The other statistic that they reported is that those with frequent nightmares are 107% more likely to die by suicide. So it means that when people are being assessed for suicide, that it really is important to ask about their nightmares and their nightmare frequency, because if they report a lot of nightmares, then clearly their risk for a suicide attempt and a successful suicide attempt is so much greater. So to bring some more bad news, it appears that the problem of suicide is increasing. And this is just a quote from Time magazine, some recent statistics that show that suicide is one of the most urgent health problems facing America today, and we can extrapolate and say that this is probably true of the entire developed world. It's the 10th leading cause of death in the U.S., claiming 47,000 lives per year, and likely more given that many suicides are not reported. So the recent federal numbers indicate that the suicide rates are rising across all the geography and all age groups and ethnicities, but that among young people aged 10 to 24, the rate increased by 56% from 2007 to 2017. So suicide rates are rising alarmingly among young people. And sadly, these are also the people who are less likely to report their mental health issues and their nightmares. Research also indicated that members of the military have increased suicide rates over the past 5 years. So this problem is getting worse, and potentially looking at nightmares might be a way to stem this tide. So here's the thing. This is kind of a perfect storm in that screening, reporting, and treatment of nightmares are all rare within the medical system. Like most health conditions, nightmares are greatly underreported, but because they're clearly linked to suicide, it would be imperative to increase the screening for nightmares among young people. As I mentioned, where suicide risk is the greatest and is increasing the most at the most rapid rate, nightmare reporting is the lowest. And one of the problems is that those with nightmares rarely know that treatment is possible. And when their problem is really bad with the most severe kinds of nightmare disorders, they're less likely to believe that treatment is possible. Even though treatment is more than just possible, it's actually the treatments that have been developed have been shown to work really well and fairly quickly and without many adverse effects or any adverse effects. So it's a shame that given that there is treatment protocols that have been developed, that very few people are able to deliver them and very few people are put in a position where they can benefit from them. Nightmare screening is rare. Nightmare treatment is rare, despite the fact that roughly 75% of patients with psychiatric samples report recurring nightmares. They're a very common problem. And even when treatment is sought, effective, knowledgeable treatment is rarely available, despite the good evidence that nightmare treatment is effective. Less than a quarter of those in one study who sought help reported getting the effective help that they needed. So there's a lot of work to be done here in disseminating the information among people that nightmares are treatable, and then getting access to the information about how to deliver treatment to clinicians. And that's part of the reason why I'm doing this course, and I'm really glad that you're attending, because one of the things that they've looked at, and I'll get more into nightmare treatments later, I just wanted to kind of outline the problem in this brief initial presentation. But what it looks like is that you can treat the disorders associated with nightmares, particularly PTSD, but others as well, and get some benefit. But the nightmare treatment seems to have a greater benefit, because when you treat the nightmares, it improves the nightmare distress and frequency numbers, but it also seems to help with the comorbid diagnoses and symptoms, whereas it doesn't seem to work the other way around. So you kind of get a double benefit from treating nightmares. So I'm hoping that more people are going to learn how to do this, and it isn't so difficult. So here's my call to action from this brief presentation. Clinicians can truly help with these problems, with this multifaceted problem of the nightmare-suicide link and the under-treatment of this problem, by advocating for improved diagnoses, improved screening at various places where they do screen for suicide and mental health issues, and also improved treatment by learning about the available treatment modalities and how to use them. Questions about nightmare frequency, distress, and duration should be included in mental health assessments in general and suicide screening in particular. And it's very rare for this to happen now. And there are front lines at hospitals, for example, in emergency rooms where people come when they're feeling suicidal, or at sleep problem clinics that are proliferating these days. There needs to be questions about nightmares that would then lead to a treatment path, or at least referring people to the right kind of help. Those with nightmares should be just generally informed that treatment is possible. And this could be something that could be like an information campaign to reach the general public. People should be encouraged to talk about their nightmares. And if they have a nightmare disorder, so nightmares that are severe and frequent enough that they cause daytime impairment in functioning and distress, then they should seek nightmare-specific treatment. And we as clinicians should make this available. Clinicians need to know how to offer nightmare treatment. Even if this is the only kind of dream work you do, even if you're not interested in doing other forms of dream work in your practice, the knowledge about how to assess and treat nightmares is, I believe, imperative for clinicians today to help treat PTSD, to treat nightmare disorder, and to reduce the risk of suicide. Thank you so much.